What is generalized anxiety disorder? My name is Dr. Jalil Mohammed. I'm a consultant psychiatrist and my job is to diagnose and treat mental health conditions. Generalized anxiety disorder is an anxiety condition where you feel anxious most of the time and in many different situations. Unlike other anxiety disorders like social phobia or agoraphobia, generalized anxiety disorder is not related to a specific situation or circumstance. The main symptom is excessive anxiety, worry, or apprehension, which occurs on more days than not for at least 6 months. And alongside the anxiety symptoms, there are usually other symptoms as well, which include things like restlessness or feeling on edge, becoming quickly tired or fatigued, problems with concentration, irritability, and problems sleeping. People with generalized anxiety disorder find it very difficult to control their anxiety, and the level of anxiety is so high that it significantly impacts their ability to function. So for example, their anxiety may be so severe that they have problems concentrating, so they can't do their work properly, or their anxiety may be so high that they feel very tired or fatigued, so they can't engage in social situations. The main treatments are psychological therapies like cognitive behavioral therapy, but if those aren't enough to control the symptoms, then medications like SSRI antidepressants can be used as well.
Most people think social anxiety looks like avoiding people, and for many, that's true. They retreat, they avoid crowds, social events, even quick conversations because the fear of judgment feels unbearable. But here is what's not talked about enough. Some people with social anxiety do the opposite. They overcompensate. They develop incredible social skills, not because they're confident, but because they're terrified of being judged. They micromanage their tone, expressions, every little interaction. On the outside, they seem outgoing, but inside, they're overanalyzing everything. The problem is, avoiding embarrassment and judgment can't be your life strategy. We know exposure is an evidence-based treatment for social anxiety. That means two things. Number one, you gotta face the uncertainty of judgment. Instead of trying to guarantee you won't be judged, you learn to accept that no matter what, it's always gonna be a possibility. No matter what you do, you may be watching this video and judging it positively, negatively, or may have no opinion on it. I don't know how it's going to be perceived, and that's exactly the point. Number two, you gotta engage in gradual exposure. Push yourself into social situations, but stay until the anxiety drops. That part is crucial. If you leave too soon, you reinforce the fear, but if you stay, your brain starts learning something different. That fear doesn't control you anymore.
Hey Jim, what is a panic attack?
A panic attack is what happens when the brain basically fools the body into going into intense fight-flight mode. It's something that happens when your level of anxiety gets to the point that your body is so flooded with stress chemicals that you can't handle it, and you start to have impending thoughts of doom. You might even have the sensation that something's going to happen, you're going to die, that something horrible is going to happen. You might get tunnel vision, have a hard time breathing. That's basically what's happening, is the mechanism that causes stress in the body has just flooded your nervous system with so much of the stress chemicals that you can't handle it.
What is panic disorder? Hey babe, I want to talk to you about panic disorder from a mental health influencer that also suffers from depression and anxiety. Please remember that anxiety is common, and it is also very normal for people to get nervous before doing something very specific. But the difference between having nervousness and an anxiety disorders interrupt your daily life where you need coping mechanisms or treatment to get through it. Now, what is panic disorder? When you have panic disorder, that means you are having several panic attacks that are reoccurring and they come on for no apparent reason. Keep in mind that panic attacks and anxiety attacks are two different things, but often get confused for being the same thing. A panic attack is a sudden, very intense fear that causes a severe physical reaction within your body, which can feel life-threatening even though there is no real immediate danger. Some symptoms of panic disorder can be a sense of danger, fear of loss of control, a rapid heart rate, sweating, trembling, chills, stomach aches and headaches, dizziness, numbness, and a detachment from the world around you. If you're experiencing any of these symptoms, they feel very intense and very life-threatening. I will have another video that explains the difference between panic attacks and anxiety attacks because I think it's really important to know the difference. If you feel like you may have panic disorder, please talk to someone and remember that you are never alone. Next, we're going to talk about social anxiety, but if you want to learn more about how to take care of your mental health, then make sure to follow me for more tips.
Obsessive-compulsive disorder, or OCD, is a mental health condition characterized by obsessions and compulsions. Obsessions are persistent ideas, thoughts, impulses, or images that are experienced as inappropriate and intrusive and that cause considerable anxiety and distress. Compulsions are repetitive behaviors, mental acts, routines, or rituals that are carried out to reduce or prevent anxiety or distress and are perceived to prevent a dreaded event or situation. Compulsions can be overt, meaning they are seen and observable by others, or covert, meaning they are not seen or observable by others. Examples of obsessions and compulsions in OCD include fear of contamination with germs or bugs and excessive hand washing, symmetry and arranging objects in a specific way, religious thoughts or fears such as the fear of going to hell and praying frequently, sexual obsessions and a need to check things multiple times such as doors or stoves to make sure they are safe and secure. The treatment of OCD includes exposure and response prevention, or ERP, which is a behavioral therapy that helps people with OCD manage their symptoms. Pharmacological treatment includes high-dose fluoxetine, which is a selective serotonin reuptake inhibitor. The dosage of fluoxetine for the treatment of OCD is typically higher than the dosage for the treatment of depression. A target dose for OCD is usually 60 milligrams of fluoxetine. Okay, I hope you found that helpful. As always, please protect your minds and protect your hearts, and bye for now.